First, I would like to pay my sincere respects to His Excellency Chair, Excellency, respective development partners, ladies and gentlemen. My name is Keanhuy. I am an officer at Policy Department at Cambodian Rehabilitation and Development Board of the Council for Development of Cambodia. Today, on behalf of the DCPR core team and also Policy Department at CDC, I'm pleased to present it on the ODA customization for 2020. So my presentation is including 5 main aspects of Cambodia ODA customization for this year, which include the objective of the customization. The first part of the customization is COVID-19 question. The second is the sector/subsector that we have been revised or customized. Fourth is regarding to the marker that we have also revised and customized for this year. And last but not least is the way forward. Let me begin with the objective of the customization for this year. We think that it's very important for us for this year to customize our ODA database because of 2 main reasons. First, we would like to align our ODA questionnaire in our ODA database with the national and international priorities. For example, as you may know that the Royal Government of Cambodia have been strongly committed to promote social protection policy framework. And this year, we think it's very important for us to track the financial support from our DP who are committed to support this policy. So that's why it is very important for us this year to customize our questionnaire to align with that national priority. Another example for the international priority is the the Sustainable Development Goals. As you know that the Royal Government of Cambodia have committed and localized SDG into the local context, which is known as CSDG. So that's why we think it's very important for us as a coordinating agency of the Royal Government of Cambodia to track the non-financial support and financial support of our development partner who have been committed to support us to realize the 2030 agenda. And second point of the objective of our customization is to reflect the current rapid changing context in this situation. As you know that COVID pandemic is one of the heated topics for this year. And we know that our development partner also have reprioritized, repurposed, or reprogrammed their projects to help the Royal Government of Cambodia to combat COVID-19 pandemics. So that's why we think that it's very important to record the DP's commitment to that want to help the government to go through this difficult time and emerge strongly and stronger. So that's why one of the main customization for this year is COVID-19 question. So in our questionnaire, before we have 18 questions, but for this year we have included COVID question as a question 6B in the questionnaire, so that we can know that whether a project support COVID national response or not. So the new question is asked, is the project design for new project or adapted for ongoing project to support national response to COVID-19. And for this question in the questionnaire, we'll have two options. Well, option one is yes, option one is no. If a project doesn't support the national COVID-19 response, you will click no. But if it is supporting the COVID national response, you will click yes. And once you click yes, there will be two options for you to choose. One is emergency response, and the second one is socio-economic recovery. And these two options have different definition. So for emergency response, we mainly focus on the health sector, but also not limited to that health sector. We also thinking about the intermediate and short-term support beyond health sector as well that can be classified as emergency relief. For example, the food package support that provided by DP to people who are the most impacted or people who are vulnerable to the pandemic. And for the emergency response, there are three components. First, we thinking about the support to case detection and management. Second, about the medical supplies and equipment, including masks and other medical equipments. Third is about the support to the health sector in terms of preparedness and capacity building and training for our medical experts and for those who are involved in the medical field. In terms of the socio-economic recovery, this is the aspect of the social and economic aspect of the support, which include the four elements. First is to help people with social protection and basic need, to ensure that those who are impacted the most by the pandemic receive the basic need and social services. Second is to promote social cohesion and investing in community leads, as we know that the government is also trying to invest in community in order to create jobs for the people in the community. And in this part, if DP have the project that support that initiative or another initiative that relate to this initiative, they may be choose socio-economic recovery. The third point is to protect job and support SME. And the last but not least is to guide the necessary search in fiscal and financial stimulations. In other words, is to support the royal government in order to come up with the national economic policy to maintain the macro stability and the economic progress. So for the COVID-19 question, we are allowing our DP to answer this question for their project which are ongoing, for new projects, and also for the completed project that still have disbursement as well. So once they record or revise their project, they will be allowed to answer this question accordingly. The second part of the customization is the sector and subsector. And one of the sector and subsector that we have revised is health sector. So previously we have 9 subsector in health sector. However, this year we have been revised into 8 subsector in the health sector, and we have revised 1 subsector from hospitals to hospital services, and we have deleted swim from the subsector of health sector, as we realize that it is not the subsector, it is more like the modality of support. Second, in terms of the sector and subsector of education, Previously, we have 11 subsector in education, and now on we also have 11 subsector in education. We have changed, we have revised primary education, which before used to be primary/basic. We have revised secondary and technical education, which used to be only secondary education. We also have revised higher education, which used to be tertiary and higher education. We also add some new subsector, such as early childhood education, non-formal education, youth development, physical education, and sport. We also deleted swap and school facility from the list of subsector of education. So this customization is based from the request and confirmation from the Ministry of Education. And I also would like to provide a few definitions of this new subsector that may be a little complicated, but most of them are self-explanatory already. So one of the subsector is non-formal education. Non-formal education here refer to the support to the programs that help children out of school who have not received the formal education, but they are going to training center or other TVET program, which is informal education and not recognized by any formal institution. But they also can learn skills and equip it with the knowledge to take the jobs. Another one is secondary and technical education. As you may know, that secondary education is comprised both lower secondary education, which is from grade 7 to grade 9, and upper secondary education, which include from grade 10 to grade 12. But technical education here refer to the TVET program that is equal to the upper secondary education. In other words, when students finish grade 9, they have option to go to upper secondary education, grade 10, 12, 11, or 12, or they can take TVET program as grade 12, grade 11, as grade 10, 11, or 12. So the TVET program, which is known as technical education here, is equal to the upper secondary education. The third sectors and subsector that we also have customized is social protection. Previously, we did not have social protection as a subsector in our questionnaire. But this year, as I mentioned earlier, the objective to align the national priority is very important. So that's why we add social protection as a sector in our ODA database. So for the social protection sector, we have added 7 subsectors under this social protection sector. One is emergency response. It's referred to the support to people who are exposed to climate change or any form of natural disaster, including flood, drought, or storm. In terms of human capital development, it comprises of 3 components. One is the social protection for pregnant women and children, so that they can receive cash transfer from the government. Second is school feeding program, which offer breakfast to primary and secondary students in order for them to continue their education. Third is the scholarship for primary and secondary education to students who are coming from poor and vulnerable families. The second point is social welfare for vulnerable people. It's referring to the support to elderly and disabled people who have limited access to economic opportunity. And fourth, it related to the Social Security pension. It's referring to the yes, it's referring to the retirement pension of the civil servant, including the military personnel and police. Another one is health insurance. It also has three components under this scheme as well. One is health insurance scheme for poor and children, which means that when they go to hospital, they will get the financial support and also food allowance as well, and other additional allowance. Second is community-based health insurance scheme. It is for citizens who are working in the informal sector. And third is the private health insurance scheme, which is also one of the elements. However, it is have not been developed yet. Another one is the employment injury. This refers to the support to the employees who may injure during the working hours. And last but not least is the unemployment, which is also a scheme for protecting citizens who have lost their job, and also while they are looking for their job. However, this scheme is under feasibility study. Another sector / subsector that we also have been revised is community and social welfare. And this sector for this year we have been renamed to community development. And its subsector is also community development, which used to be community and social welfare services. So community development here we refer to the projects that are designed to create conditions for economic and social progress for the whole community, especially the poor and vulnerable people, but not fall into the National Social Protection Framework. In other words, any other support that cannot be classified in the Social Protection Framework, we can put it in the community development. Another sector / subsector that we also have been revised for this year is gender. So before we only have sector gender, subsector gender, and others. But this year we have added new subsector for gender as legal and policy framework, gender research, statistic anomaly, mechanism, networking and partnership, accountability and gender, responsive investment, positive public behavior, and other. So I'm not going to give the definition of each subsector, but I know that His Excellency from Ministry of Women Affairs also joined us virtually. So if you have any question regarding to the definition, His Excellency may also help to clarify those questions. So the three big aspects that we also have customized for this year is related to marker. Previous year, we have one thematic marker, which is known as cross-cutting thematic marker, that we have 18 cross-thematic marker. But this year we have revised and also compromised it to only 3 main thematic marker, including gender, climate change, and private sector development. And each for gender and climate change, we have a specific guideline for our development partner to complete or to select those markers. So why do we have to create marker in our database? So our purpose is to track mainstreaming support and non-financial contribution to this thematic marker. So let me give you an example for this specific feature. So for example, if our development partner support road building projects, but those the road building project is also require the road building process to be climate resilient. So this example for this project is that the main sector for this project is transportation, not climate change. However, since the condition in the project require the road has to be climate change resilient, so development partner also can choose climate change thematic marker for this project as well. In terms of the rating, in this thematic markers, we have divided into 4: no, minor, moderate, and significant. And each category is also has the guideline to complete as well. The condition of this to select this thematic marker are selected main sector cannot be the same as cross-cutting thematic marker. In other words, if you check your main sector is gender, you cannot click thematic marker as gender as well, because your project is already supporting gender and it could not be mainstreaming gender at the same time. So, but if your project supporting transportation, you can say that your project is also mainstreaming climate change or gender, you can choose that thematic marker. Second condition is the total contribution is less than or equal to 100% if more than one marker is selected. In other words, if you select more than one marker, the total percentage has to be less or equal to 100%. Second customized feature regarding to the marker, we have added CSDGs Marker. As I mentioned earlier about the international priority and the alignment of the Royal government. So the purpose is to track financial support to CSDGs. So this here is a direct contribution, not a mainstreaming. And we will ask our development partner to fill a percentage in each goal that they think their project are supporting. However, when they select those goals, they have to consult with the selected sector. So if, for example, if their project is supporting education sector, they may choose goal 4, quality of education. But they also have to consult with their project document and the CSDG framework as well, in order to ensure that, to make sure that the project are contributing to those specific goals that they choose. And second condition is the total percentage is less than or equal to 100%. In other words, you cannot put the percentage to any particular goal or any of other goals more than 100%. The third condition is the maximum number of goals is 3. We think that in general, based on our practice, a project cannot contribute more than 3 CSDG goals. So we have limited our development partner to choose only 3 goals for the maximum of 3 goals for a project. Last marker that we also have add on to our ODA database as well is the social protection framework. I'm sorry, social protection marker. So this one is different from the social protection sector. So the purpose of this one is to track financial support to the National Social Protection Policy Framework. And in order to complete this one, you just have only checked the subsector in the marker. And the reason why we create this feature is because we want to know the direct contribution of the selected subsector. So let me give you an example to illustrate this point. For example, HEKIP program. The main sector of HEKIP is not supporting social protection sector, but it's supporting a health sector. However, in HEKIP program, it also intends to improve access for Cambodians poor by paying for costs of healthcare as well as transportation and incidental costs associated with hospitalization. So, which means that this program supporting health sector but also fall into the National Social Protection Framework. So in this particular example, DP can choose health as their sector, but also click the marker social protection as well. As I mentioned that there is element of social protection in their program. So to sum up about the customization for this year, we have added new question for COVID-19. We also have added sector/subsector, including health, education, social protection, community development, and gender. We also have revised and added markers, including cross-cutting thematic marker, CSDGs marker, National Social Policy Framework marker. So for additional support, we also have updated our ODA user manual for this year as we have been distributed. We also will provide outreach support to our development partner if you want us to clarify or provide more information. For the technical support, we also have our database administrator for providing the technical support as well. Last but not least, I also would like to share a way forward what we are going to do after this customization process. So as you may know that our data validation is starting from now on, and it will be expected to complete it in the first week of February. We also will do the drafting of the structure of our new DCPR for this year, and we will also extracting data and analysis around around February and expect to finish in March. And we're gonna do report writing, which expect to finish in April. We will also expect to finalize the report in May and translate the report in May as well. So thank you very much for your attention, and I will take all the questions from you all if you have any question, and for the question that we can answer now, we will be getting back to you later as well. Thank you very much. Thank you, His Excellency.